So many people are looking to live happier, more stress-free lives. We provide interviews from mental health experts across various fields because we know finding quality information isn't always easy. Let's find more sanity together.
Okay, welcome back to the second episode of the Psychedelic Assisted Therapy podcast episode. I just said episode twice. Oopsie. Of the ABCT Sanity collaboration. We just left off talking about potential harms in doing psychedelics incorrectly, and that could either be recreationally taking too high of a dose or going into the wild, wild west treatment in the psychedelic underground, which I think is a very interesting coined phrase, that could cause harm. So what are some of the harms that could happen if someone does take too high of a dose or does have a bad experience doing psychedelics?
Yeah, so I think the harms are more psychological in nature. The experiences can be really scary. There's one of the terms that's used a lot to describe psychedelic experiences is ego dissolution. This idea of our sense of self being so dramatically altered that we kind of lose touch with having a body. We might lose touch with language, not be able to kind of communicate or speak. That might sound really, pleasant or positive, and it can be. It can be really transcendent. It can be really, have associated with like feelings of bliss or awe or joy. But it could also be really scary if you're not prepared for that, or if you're in a place where you don't feel completely safe. The experiences themselves can involve a lot of strong emotions, both, on any end of the spectrum. So, we're mentioning some of the positive emotions, the joy, the transcendence, the sense of connectedness to all, can be really powerful and transformative emotional experiences for people that lead to positive change. But it's possible to also experience a lot of strong negative emotions, profound sadness, profound fear, grief. Sometimes, with psychedelics, it's not uncommon for prior trauma to come up. This is a commonly reported experience where people will sometimes even re-experience their trauma. And in cases where they didn't necessarily, they might have said before, I've already dealt with that, I don't think about it anymore. And yet it still might come up in a psychedelic experience, which, if you're prepared for it and you have the right support and it's sort of informed consent and you go into knowing that is one thing. But if you take mushrooms at a concert and you don't know that trauma can come up and it starts to come up, you might really start to panic and think something's wrong. I did something horrible to myself. People will often say things like, I broke my brain or I damaged myself. Sometimes these experiences can be traumatic for people in these sorts of environments where there might be a lack of safety. If they're out, at a like a concert or something, and there's a lot of people and they get lost from their friends, that can be, really terrifying in an altered state of consciousness. There's a wide range, I think, of ways that people can have challenging experiences. There's this notion in psychedelic culture that there's no such thing as bad trips, meaning that any challenges that come up have some sort of therapeutic benefit once you work through them. And my opinion is that that's not exactly helpful advice. I think in the context of the research and safe, supportive environments, that is mostly true. When things come up, they can sometimes lead to some sort of change that's positive. But I think in uncontrolled settings, sometimes a bad trip is just a bad trip. Like it's just scary or it's just overwhelming. And that can stay with somebody for some time afterwards.
I've had more than one client that have taken shrooms or something and they had a really bad trip. And then it has since it caused the panic disorder, where they now fear physical symptoms, and it was kind of like the triggering event that led to years of panic disorder, or the fear that the psychedelic experience caused some mental harm. And if you think about that overlaying with like an OCD, kind of like I call it mental health anxiety, like what we would call hypochondriasis back in the day for physical health. There is mental health fears like that where you get obsessive. And I've seen a bad combination of that. I did the shrooms, I did whatever, I had a bad experience, and now my mental health and cognitive functioning is permanently disrupted, and I do exposure therapy around that. But yeah, Jason, same question. What's your thoughts about some of the harms that psychedelics can do if done incorrectly?
Yeah, I think you also point to one of the things we didn't talk about too much was that the psychedelics can also have really powerful somatic effects that they can manifest as just very powerful feelings in the body, the most powerful, experience of dizziness you've ever had, or fear or nausea, or just sort of a sense of transformation of your bodily felt sense. And that can be potentially very helpful depending upon what happens, or it can be very, very difficult. And I guess I do want to get across the message that these are powerful substances that need to be used very carefully. And I think sometimes as psychedelics are becoming more and more of a thing, and there's more and more hype, I think people are getting disconnected from the cultural context that these are often embedded in, and that have largely served to teach people how to do these things safely and in a way that can be beneficial. And so there are a lot of risks that people don't maybe appreciate or know about. There's also just physical risks too. Like Brian pointed out that primarily the risks are psychological or maybe interpersonal, like you could be assaulted or mistreated because you're so vulnerable in the higher dose experiences. But there are physical risks. The most obvious would be someone walks into the street, they're disoriented and they walk in front of a car and get hit, or something like that. Or it's not uncommon someone might get dizzy and fall down and hit their head or something. But it's also important to keep in mind that there are many different psychedelics, and while some of them are physiologically very safe, some of them aren't. And so you do need to be very educated about the specific psychedelic, and they can also have interactions with other drugs. And many of us are on medications, and some of those medications interact poorly with some of the psychedelics, and it's all very complicated. And not that well researched even. So there are a whole range of risks, and that's why we think the research is so important to try to figure that out, how to do this stuff safely. And then I guess in terms of talking about possible harms, there's another kind of harm that I think is also worth mentioning, which is the harms that have occurred culturally due to psychedelics. You mentioned the kind of oppression of psychedelic use in Europe, but also there's been a lot of harms that have happened to indigenous communities, and we're in the United States, and indigenous communities in the United States or in the Americas, who many of them had ceremonies that were really core to their cultural practices and their health. And in addition to Europeans coming in as settlers and just wiping out people, there was a whole layer of intentional suppression of cultural practices as well. And now, as Americans or European white Americans I'm doing the air quotes, rediscovered psychedelics or discovered psychedelics now, there has been a lot of cultural appropriation that has come along with that, and it's led to another wave of exploitation of indigenous peoples as part of this as well, and that's something that hasn't really had as much attention. And I think if you're getting involved with psychedelics, either as a therapist, a facilitator, or as a consumer or user, I think people really, should learn about that cultural history and appropriation that is part of what it means to be, particularly like a white person using psychedelics, that you are benefiting from something that is wrapped up in a lot of exploitation and harm.
And I mean, I don't know too much about this, but can you imagine the cultural impact where you've been doing something for hundreds of years that was central to your culture, and psychedelic use, like you said, has been central to many cultures and experience and healing and connecting with God, spirituality, part of religion, and then someone coming and saying, "No, that's bad. You can't do that." And just the complete sloth of your culture being outlawed or taken away.
Exactly. Yeah.
Okay. Anywhere
Can I just
go
add one more harm that might be good for listeners to know about is the potential for classic psychedelics to exacerbate underlying psychosis or bipolar disorder. And so traditionally in the trials, folks with a history of psychosis or immediate family history of a psychotic disorder or bipolar disorder, they've been excluded from the trials because it might be the case that, and there's some case reports of psychedelics kind of triggering a psychotic episode or a manic episode. Again, if you have an underlying predisposition, there's no evidence that it causes that. But it's just something to be aware of. And I'll say it's true that I've met people with psychotic disorders and bipolar disorders who've reported that psychedelics have been helpful to them. So it's not a blanket statement to say that it's absolutely dangerous, but it's something to be aware of if you have that history, to be extra careful.
Okay. No, that's a good, I remember learning about that in Drugs and Human Behavior, but I'm not sure how widespread that knowledge is. So this is always, I think, one of the tougher questions that I ask people. But when people are listening to this, they're like, what is actually going on? Like if I was sitting in the room, or if I was a patient and I was experiencing it, like experientially, or like what is this? And for you two, because you do it so often, it's like, so like me going, what does a CBT therapy session look like? And me trying to just like, yeah, of course, you just do and then we'll do an exposure and then, whatever it is. But for those of us that are wondering, what does it actually look like? Can you give us some insight into what you're talking to people about? What are typical experiences people have when they're laying down and they're blindfolded and they're listening to, I'm assuming, music, because you said headphones. Mm-hmm. Yes. So yeah, sorry, I'll stop talking, please.
Do you want to take it, Brian, or
We're
talking about the medicine session itself?
So, yeah, and then the integration. Yeah.
So again, these things vary, but I'm going to speak more from the clinical trial sort of standpoint. And so typically the sessions would be a full day. They'd be scheduled for a full day. The client would be there, participant would be there for 8 hours. And they would arrive in the morning, and there'd be a bit of preparation where you'd be kind of orienting, going over some of their intentions or goals for expectations, things like that for the session, reviewing kind of final safety related topics, and just kind of talking about the plan for the day. There'd also usually be conversations about the role of touch. Touch is something that most, I think, therapists are not well trained to use, and we're often very uncomfortable with it. But being able to touch as part of a psychedelic session is often seen as quite important and can be quite valuable when someone's, say, in a very powerful emotional state or psychological state, to have the ability to hold someone's hand to ground them or something like that can be quite valuable. And so there's usually a conversation. This usually already happened as well previously, but there's a kind of revisiting the role of touch and making sure there's consent about how much touch is okay and how it will be used. The type of touch that's used is usually relatively limited, but it's an important part. And then typically the person is offered whatever is the substance. And shortly thereafter, they typically will put on some eye shades, and like blackout eye shades, and a nice pair of headphones with good bass. And they go inside, and there's usually a curated playlist of songs that start off more gentle and soothing, and usually become more intense as the medicine peaks, as the experience peaks, the dose peaks. So usually 2 or 3 hours in, the music is often more intense in various ways. It could be more rhythmic, or it could be more soaring, or maybe even dissonant, but it's usually more evocative. And then the music kind of tends to tail off again as the person comes out of the medicine, and into usually more gentle and more introspective types of songs, usually not in a language that the person understands. So we don't want them to kind of go on the trip that the singer is giving them, and so the music kind of the language kind of leads them down that. We want them to have the freedom to have their mind go where it needs to go into the topics or the memories that maybe they need to process, or that they would benefit from touching into in the session. And usually this is, again, it depends on the psychedelics. We're talking about classic psychedelics. People will spend the majority of their time with their eye shades on, what we call going inside. And but they will come out at times and perhaps talk to the therapist. But the therapists are largely there to sort of help them through difficult times, and then to help kind of redirect them inside. And the experience of what happens for the person is just incredibly variable. And so we've described a number, I think, of the experiences that are typical with psychedelics. But I would say from maybe what might be helpful to talk about is what we think we know about what experiences tend to be associated with better outcomes.
Yeah, great.
And so maybe I'll speak to maybe a couple things, and then Brian, maybe you could add more as well. So the one that's gotten, I think, the highest, the largest amount of attention is the occurrence of mystical experiences. And so what is the most central aspect of a mystical experience is the perception of unity, a sense that you are one with the universe, and that there is no separate sense of self. There's just the universe, and you as the universe. And that experience also tends to come with other things, but the central experience is that sense of unity. And when people have this mystical experience, that often predicts better outcomes. There are quite a few studies at this point that have associated the intensity of the mystical experience with beneficial effects, whether that's depression reduction, whether that's changes in health, like death anxiety with people who have terminal illnesses or severe illness, whether that's improvements, reductions in smoking. The likelihood of being able to actually stop smoking, for example, has been associated with the occurrence of mystical experiences. So there's something about this transcendent experiences that seems to have enduring effects, that as people take that into their life and coping with their normal day-to-day situations and emotions and thoughts, that can transform how they live their life subsequently. I'd say the other variable that has a fair amount of research supporting at this point is psychological flexibility. So this kind of concept that emerged out of the ACT model originally, and is this idea of basically being able to have the capacity to embrace your experiences, not get so caught up in your thoughts, know what's important to you, and be able to take action towards those. This kind of psychological flexibility of not getting so stuck in your normal ways of responding. That when that occurs during psychedelic experiences, we also have quite a few studies also showing that psychedelics are associated with improvements of psychological flexibility. I guess I meant to say, I realized as I was talking, this is not very podcasty of me. I misspoke, but we know that the psychedelic experiences are associated with improvements in psychological flexibility after, is what I should have said, not that when psychological flexibility happens during the sessions, that predicts subsequent improvements. We know that the psychedelic experience are associated with improvements in psychological flexibility. And then when people have improvements in psychological flexibility as a result of the psychedelics, that predicts other kinds of improvements like depression or smoking or things like that. So it seems like changes in psychological flexibility are also implicated in how psychedelics function.
I'm very fascinated with the ego dissolution. Is that the right word? And I'm going to try and describe this without butchering it, but the way that I look at it, it's like a dampening of yourself in your experience. So reducing your biases, reducing your perspective in a way so you can see things more universally or outside of your typical box, maybe is a better way of saying it. If that's correct, how much is the therapeutic, and maybe we don't know, like the therapeutic effect mediated by that ability to chill that out so you can think more broadly?
Yeah, I would say that it's not as much of a dampening or a lessening. It's more of an expansiveness, right? So it's a change. It's an expansiveness, and it is kind of very often like being outside of my belief system, being outside of the way I normally experience my body or the way I normally experience sounds and colors. It's sort of like, it's kind of a cliche example, but if you think about a fish doesn't really know it's in water until one day it flops out of the water, and now it has a completely new context in which to really understand what water is. But until then, we don't see it. The fish doesn't even know it's in water, right? And so we are walking around constantly filtering information based on our history, experiencing life in a very limited way, right? That's kind of what our brains have evolved to do, is to really reduce all of the sensory information in a way that it thinks is helpful for us, but often winds up producing suffering. And so this idea of stepping outside of our thoughts and our feelings and the way we normally experience ourselves can be associated with a profound sense of relief, or a sense that there's more out there, or that I'm not limited by that. That's just part of me, but there's other possibilities. So it is expansive, or it increases, like Jason said, psychological flexibility. And so it's not just about, some people will say, well, isn't this just about getting high, or is just some form of escape? And it might be a temporary relief, but it often can be, for folks who are profoundly depressed, let's say, really therapeutic for them to experience a sense of bliss or hope or joy that they didn't think was possible. And it kind of proves to them, like, it is possible for their brains to experience these emotions and to have a greater range. And I think, psychedelics also, one way I think about psychedelics and how they work is that's in contrast to, say, antidepressants, which is one great tool. I think it has its place. I'm not completely against antidepressants, but they tend to work by sort of narrowing our range of emotions, right? They kind of numb it down a little bit. And I think psychedelics, they expand it. And one way they do it is by throwing us into the extremes. So we have this more expanded range of emotions. And very often people will encounter things they've been avoiding. They think about this relationship that they had. They think about their job. They think about their partner. Things that are difficult, that we can get very good at avoiding. I think sometimes we don't even know we're avoiding certain things. And psychedelics, mushrooms can be like, here, like, take a look at this. And that's not always pleasant, but it can be really helpful. So, people will come out of these experiences saying things like, I thought a lot about my job, or I thought a lot about my grandfather, or I remembered, this trip I took and it reminded me that I really love traveling. I want to be kinder to my body. I want to be better to the environment. I want to spend more time with my kids. I want to be more present in my relationships. These are common things that people already know. Like, none of that is new information. We all know we should be more present with our kids, or we all know we should treat our bodies better. But there's something about this experience of it that can really set in stone like a different path. And we see that. We see people that with the right support and intention, that they can kind of stay on a path of behavior change. And again, that I think speaks to the importance of the integration process and the therapeutic support that happens after an experience.
I thought a lot about like almost like two pathways, in which I feel like that you talked about. One pathway is actually like facing your discomfort or processing things, and that might be a little bit more uncomfortable. And then the other one is almost like priming a system that's dormant. Like when you're depressed, priming that more positive system in order for your brain or you to recognize that you could experience that and there's another way of doing it. Or if you ruminate all the time and you're able to distance yourself from that and maybe see it a little bit less relevant and experience what that's like, for you to have almost like a learning experience to do things differently. That might be an oversimplification, but are those like two kind of pathways going on? Is there another pathway that you could think of that might be going on during this expansiveness and ego stretching?
I think that makes me think of some of the neuroscience research and theory, which we haven't talked about much here. Many of the neuroscience researchers are talking about psychedelics inducing a period of plasticity after the experience. And basically, if we're thinking about this from a CBT perspective, what we're talking about with plasticity is we're just talking about a period of enhanced learning. And so the thing about learning, though, is that if you're in a plastic state and you have enhanced learning, it really matters what happens during that period. So if there's a hyperplastic state or a critical window of learning that opens for hours or days or weeks afterwards, then what you do in those hours and weeks afterwards is huge. Because if you could imagine you were, say, given a medication that made you very receptive to math learning, but you didn't do any math problems over the 2 weeks that it made you receptive, you wouldn't learn any more math. So it wouldn't matter that you took the drug. And psychedelics, there's research that suggests that may be the case with psychedelics as well, that it opens up this possible learning window, which is part of why the therapy part, the integration phase, may be so important. Is if this is true, then it's that the therapy is part of creating those learning experiences as people bring their new experiences into contact with their environment, and they try behavioral experiments and various things like that. Another piece of the neuroscience research connects with the comment you said about kind of positivity. There's a set of research, 2 papers published in Nature by this scientist out of Johns Hopkins, Gould Dolan, where they were looking for this idea of critical windows for learning in mice, and thinking that this might be true in humans. And basically what they found was that it's complicated to explain all of the experimental conditions, but the basic idea of it is that mice have periods of their life where they're kind of more interested in social relationships with other mice. And then as they become adults, they're kind of not as interested in meeting other mice. Basically, they don't get as much positive reinforcement from encountering other mice. And what they've shown is that you can take adult mice, and if you give them a psychedelic but only in the context of hanging out with another mice. If they get the psychedelic and they're not with another mouse, this doesn't happen. It's only if they get the psychedelic and they're hanging out with another mouse. Then there's a period of time afterwards, and it depends upon the psychedelic, but it could be hours, it could be weeks after. The psychedelic is long gone from their system, and it could be hours or weeks afterwards. That preference for wanting to hang out with other mice and the positive reinforcement, they've actually done these trials where they see if there's more positive reinforcement. The mice are more positively reinforced by interactions with other mice for up to weeks after this one time of hanging out with another mouse with psychedelics on board. So what it suggests is, and again, there's zero human evidence on this at this point, but what it suggests is that psychedelics may open up a window that could last, again, for hours or weeks after the session, assuming the psychedelic was taken with a therapist or with another person, that wherein their experience of social relationships may change. Perhaps they may get more out of them in some way. They may be more positively reinforced. Now, again, this is a very early days hypothesis growing out of the animal models, but that is one thing that's being kind of proposed as a possible mechanism.
Yeah, and I'm just, humans like to default back to old behavior. Like when you're trying to do new learning, we're very quick to pop back. So a question that I had was like, I don't think there's an answer because probably the study didn't do this, or maybe they did. So you do this thing with the mice, and then you have them either interact with other mice or you have them go solo, and then 3 weeks later introduce them to the mice. My suspicion would be that if they had that social break because they weren't practicing the behavior during that plastic window, that mouse would be maybe somewhere in the middle, or being less positively rewarded by social experiences. And that I would suspect that after you go through this type of therapy and you have these realizations, I want to eat better, let's say, you actually practicing is not going to just stick. You need to practice what you preach in order for it to become an actual new pattern. And that's probably the hard bit, just like any other behavioral change that we do as humans, that it might be a catalyst for you, but you need to effortlessly move off that catalyst to keep going.
Exactly. And that's what the integration is for. And that's where, CBT or evidence-based approaches, know a lot about how to help people to make behavior change and to take insight, which psychedelics can resolve a lot of insight. Like that is one of we didn't really mention this, but that is one of the things that's commonly mentioned with psychedelics, is that people will have profound insights into their own lives, into their own functioning, into their own values and purpose. And then they come back to life. And, that's where the therapist can be very helpful in helping to put that into action, and also to help with often the dissonance that's created when you come back to life and it's like, you're back to your old job, doing whatever mundane thing you do on your job. And, you just had this profound experience of the infinity of the universe. And how do you cope with, flipping burgers or even seeing your next client, and the mundanity of that when you just came back from, ultimate love or an encounter with God. And therapists, are there to help people to put that together and find a way to exist, in an ordinary state of consciousness.
All right. Before we wrap up, just want to give both of you guys the opportunity. Any last thoughts or anything that we didn't cover that you think it's important for our listeners to know? And Brian, I'll start with you.
Sure. I'd say that psychedelics are maybe not for everybody. And we're just, again, want to emphasize that we're in very early days of understanding who they're best for, what conditions that we might want to use this as a treatment for. And because of the resources that are involved in psychedelic-assisted therapy, namely, most research trials have 2 therapists present during the dosing session. Because it's a long day, because it's helpful to have 2 people in the room, it's very expensive. MAPS, which does the MDMA research, put out a cost estimate that it's somewhere, $9,000 to $12,000, something like that for the full, all the prep sessions, the 3 MDMA sessions, all the integration sessions. And so there's issues about accessibility and cost when this new treatment is going to be disseminated. I think, that's something that many of us have in mind about how to make this treatment as accessible, as cost effective as possible, so that the most number of people can have access to it, and that we're not replicating some of the existing systemic inequities in current healthcare by just having it be affordable to upper class folks who can afford it, especially given that insurance companies may not initially cover it. So I think it's a real issue that goes along with this treatment. And one of the concerns, I think that is fair, is that this will become sort of an exclusive thing. And there's many in the field who are hoping that this is available to everybody.
And I should have asked this much earlier, but the conditions that this has been researched for, I'm assuming, is depression, anxiety, OCD-related disorders, trauma. Anything out of that I'm missing that the research is focusing on? Relationships, I'm assuming, like couples counseling, maybe?
Only in the context of PTSD so far, in terms of the research. There's a lot of things that have been studied at this point: smoking cessation, various forms of substance use, eating disorders. There are studies with chronic headaches, body dysmorphia, social anxiety. There's been quite a few studies. Some of the best research is on people confronting the end of life and having anxiety and depression around that. I think that covers most of them, and then that have been published. But there, at this point, there's probably studies on the majority of the diagnoses in the DSM right now that are in process, plus a number of health, like more physical health type conditions as well.
Okay. And while we're here, final thoughts on your side, Jason, of anything we didn't cover or anything important for people to take from this talk?
I would say I'm imagining there's probably going to be ABCT members listening to this, and I guess I would encourage them to, if they want to be involved, to be involved. And I personally think there's a need for more therapists who are coming from CBT or more evidence kind of informed background. We need more of those folks in the psychedelic world to bring that practicality and the link to empiricism, because we've talked about a lot of pieces here that with psychedelics that triggers these transcendent experiences. We've talked about things like God and spirituality, and there are ways to study those things, and there are ways to work with those types of human experiences and do that inside an evidence-based framework. And I would love to see more of that involvement of psychotherapy folks, psychotherapy researchers that think about that in this area, because to date, the area has been, from a research perspective, been dominated by more like biological types, neuroscientists and physicians, and the psychotherapy has been quite neglected from a research standpoint. And then in terms of the community, if CBT folks start getting involved, they may find themselves feeling like outsiders a lot, because most of the community is not folks who are trained in CBT, and often they will have very negative attitudes towards CBT even. And so we'd encourage folks to there are people out there who are bringing CBT into it, and you got to maybe look a little more. And we want to encourage people that this is interesting, and there's a lot of room here for diversity, including diversity around the types of scientific and theoretical approaches that people are bringing to their work. So feel free to reach out to us as well, and trying to help people get connected if you want to learn more about the role of CBT and how that can work in the context of psychedelics.
And we didn't say this, or you guys didn't say this explicitly, but the research is compelling, right? Like the good impacts on mental health are there.
Yeah, exactly. We didn't talk much about the research. It's early days. There are some quite good studies. There's a couple really good studies on with MDMA and PTSD that are looking like MDMA may be a very important new treatment for PTSD, and it's likely that MDMA will be approved by the FDA in 2024 and available. But there are also studies with a lot of other conditions. Perhaps one of the most impressive is a couple studies on smoking cessation, just to give people some sense, where 1 or 2 psilocybin sessions led to abstinence rates at 1 year follow-up of between 50 to 60%.
Wow.
And if anybody knows the smoking cessation literature, like 20% is really good, 30% is almost unbelievable, and so 50 to 60% is just off the charts. And so there have been 2 studies now with those kinds of outcomes from relatively small interventions, and these are actually it's motivational enhancement therapy combined with psilocybin or a placebo. And I think that one's just the effects are so remarkably better that it's just so obvious to see that this seems to help. But we also have a lot of data with depression as well, and some other conditions, and early days. And we always have that the early studies always have bigger effects than later studies, and we're already starting to see some of those drops in effect sizes as more studies come out. But I think all in all, as a researcher, the data are promising, and I'm sure we'll have failures and things that get moderated over time, but it really does look like there's something new here for a lot of people that can augment what we already have in terms of evidence-based therapies.
You mentioned if people want to reach out, they could. How can they find your information, or if they want to learn more about the research that you've been talking about? What resources can we offer people?
Sure. The training, we do kind of introductory level trainings regularly at portlandpsychotherapytraining.com. And so that would be a good place to look for workshops. You can find our contact information there as well. Our contact info is also at portlandpsychotherapy.com. It'd be easy enough just to Google our names and find our stuff. And we have articles and things that are open access that people could read as well, that we've written that relate to these topics. And I think just some Google searches will easily turn up stuff that we've written. And if you have other ideas.
Yeah, just to say, if you're an ABCT member, there's a Psychedelic SIG, a special interest group that you could consider joining, that Jason and I are part of, and meet other colleagues who are interested. So even if you don't know anything about it, you just want to find out more, join the SIG and come to an event.
Okay, well, I think you guys are both going to be at the conference next week, the convention next week. So
yep.
If you want to meet either of these 2 people, they will be there, and their names. And sorry if I offered you up without giving you a nod first, but I'll be there as well. Well, thank both of you guys for taking the time to talk with us, and I think a lot of people are very interested. And I think it's an area that people just don't know too much about. And so I really appreciate you guys coming and sharing your knowledge and what we know, insofar.
Yeah, thanks for having us. Pleasure.
Yeah, thanks for having us. Yeah, it was great to be here.